Please seek urgent medical attention if your child develops new tingling, new numbness, or new weakness in their arms or their legs. This video is intended to provide you with general instructions. For further questions or comments, please contact your healthcare provider. Make sure to gather all supplies prior to starting. This includes water, soap, washcloths, dry towels, and extra pads. The child should be lying flat with their head in a neutral position and arms by their side. Head should not be turned to either side and should not be extended or flexed. Care provider 1 will ensure the child does not move and will maintain cervical alignment by placing both of their hands around the side of the head and neck. The hand position will remain the same until the end of the collar change. Care provider 2 will be changing the pads. Additional care providers may help to turn and wash the child if needed. Remove front of collar. Once again, care provider 1 will ensure the child does not move and maintain cervical alignment. Assess the skin for redness, breakdown, and pressure sores. Clean front of skin with soap and water. Dry thoroughly. Remove soiled front pads and attach clean pads to collar. And slide the back portion of the collar off. Remove soiled back pad and attach clean pad to collar. In preparation for log rolling, the child's arms should be at their side with palms resting on their thighs. Be careful not to twist or bend your child's body or neck as you roll them. Care provider 2 is now ready to log roll, and care provider 1 will maintain cervical alignment. Log roll the child. Assess the skin for breakdown, redness, and pressure sores. Clean the skin with soap and water and dry the back of the neck thoroughly. Log roll the child back to supine position. Replace back of collar by sliding it under the child's head and neck, and then replace front portion of collar. Attach Velcro straps. Tighten collar straps and recheck for proper fit. The chin plastic piece should be flush with the end of the chin. The chin dots on the chin pads should be hidden. The Velcro extends past the mark and the front and back panel overlap. The flex tabs on the back of the collar should be bent to spread out the support. Please check section called Checking for a Well-Fitted Collar for further instructions. For Vista collars, follow the instructions given to you by your child's healthcare provider. Contact the prescribing team if the collar is becoming worn down and or the Velcro straps are becoming unstuck. You should contact your child's primary care provider if your child has increasing neck or back pain and pain medications are not helping, worsening or new skin breakdown, dizziness, or increasing headaches.